Thank you for coming. We are going to be doing this the first Wednesday of each month from now on. So even though that's not the case this month, we will continue with that so parents can plan for it a little bit more. We know this was kind of last minute this time. So I just want to go over a few things like why virtual learning. We always want to lead with our mission and values in the forefront, and one of them is compassion for our learning community, which includes keeping everyone safe and listening to them and responding to what they are telling us. There's also a lot of information about it being unsafe to congregate in close quarters based on the COVID pandemic. It is getting better now, but we're still not there. But as you know, on every Monday we tell you, or I share the data and you can see that it's trending downwards. But it's still not where the health officials say it should be for people to congregate indoors close together. Also, there's an inequity and lack of access potentially to health care for certain populations. And so if people did get sick with COVID, we wanted to make sure that we wanted to take into consideration that they may not have the access to get the help they may need. We serve some of our people that we serve are in a marginalized group, which means they don't have that access to certain things that other groups may have. And most importantly, we are an independent private school sponsored by the Felician Sisters, and we make decisions based on SJA families and students' best interest. We don't make decisions based on just because what other schools do. So we take what you, the parents, tell us, what our teachers tell us, what our other stakeholders tell us, and we move accordingly with that, with their best interests in mind. A few recent updates on COVID-19. There are two new strands of the vaccine that the vaccine does not protect against. Sorry, two new strands of the virus that the vaccine does not protect against. Teachers and staff do not have access to the vaccine yet. Some news came out yesterday that hopefully March 1st, teachers can start getting vaccinated, but as with a lot of things with COVID, we kind of wait to we see it before we believe it. That's what they're saying right now, but we want to see that it's actually happening. Also, there's studies coming out that students post-COVID may have different health issues, including pulmonary issues, which are issues with the lungs. And then there's data out there that suggests that students are not super spreaders, or I should say that's coming to school is not a super spreader event. But that doesn't change the fact that students can still carry the virus with them wherever they go. And if they carry the virus, then they can get other people sick. The Milwaukee Health Department reopening document, I just want parents to know that we do have our safety plan submitted to the health department just to make sure that when it is safe to return, we are ready for it. Currently, staff is unavailable to review the plans because there's a new commissioner that they are training, but there should be a 2-week turnaround. So we should know if that health plan is approved. If the plan is approved, that's great. That doesn't mean we're going to open the next day, but it does mean we have the ability to start bringing students in if all the other factors indicate that it is safe to do so. So one of those factors I share with you each week is the metrics. And we look at the 3 zip codes in which 81% of our families live, which is right here. And we use the data from Wisconsin Department of Health Services. So you can go to this website as well and look at the data. And so we calculate every 7 days, we calculate how many more positive cases there are. And so you can see here the trend is down, and just as of last Monday, it went down a little bit further to 16.11%. But again, we're looking for 3 to 5%. Here's the feedback from parents. I wanted to share with you what you said. So we had 135 responses out of 363 SJA families. So over a third of SJA families responded to the survey, which is good. course, we would like it to be 100%, but over a third is good. So 90% of parents said that there is a strong sense of community in SJA. 93% said that they have a positive relationship with their classroom teacher. 89% of parents said that SJA provides high quality instruction. 83% say they agree with the decision of SJA to continue virtual learning and not reopen on March 1st. 75% say that their child is growing in their learning this year. And 80% of parents say they are pleased with the overall distance learning plan implemented by SJA. So this is all strong evidence to continue virtually for the time being. But again, this is one factor. It's not the be-all, end-all, but it is a very important factor about how you as parents feel about the direction for the rest of the school year. Some feedback from staff. They've also surveyed them, and we had 70% responses by the time I put the presentation together. So our staff say that half of them have or live with someone who has a pre-existing condition that makes them at high risk if they get COVID-19. And then this statement was, do you agree or not agree? And this statement was, students who regularly attend, participate, and turn in work are learning and growing this year. And I broke down the strongly agree and the agree just to show you that 46% of teachers strongly agree with this statement and 50% agree. Only one teacher disagreed. So it's very compelling, very important that parents understand this. If your child attends every class, if they participate, if they turn in their work, that they are learning and growing. So please keep that in mind and reach out to us if you're struggling with that, or if your child is struggling with that, because we can help. And then the last statement, opening in April or May will contribute to more learning loss and disruption than if we continue to strengthen our virtual learning model. And here 64% agreed with that. 27% of teachers were neutral, only one person disagreed. And what this is talking about is since we've been in virtual learning all year, if we were to open our doors, let's say in mid-April or May, would the kids continue learning like they say they are here, or would it actually be disrupted? And according to the teachers, most of them say that the learning would be disrupted. So again, this is just another factor that we consider. Some of the CDC guidelines, which is the Centers for Disease Control, which is a piece of the federal government, their guidelines to keep mitigating this and limiting the spread of the COVID virus is to do these 5 things. Wear masks, keep yourself distant 6 feet or more apart from each other, wash your hands, clean facilities, and improve ventilation in doing contact tracing, isolation, and quarantining in buildings. So some criteria to safely reopen. Again, I've gone over some of this, but this is kind of all of it in one page here. So the community positive rate needs to be between 3 and 5% for 2 weeks or more to consider that a safe number. Some of our parts of our building are pretty old and some of the rooms are small. So to have kids 6 feet apart or more is a challenge in some of our rooms. Scheduling for quarantines. I call this the yo-yo effect, but what that means is that if a student is positive, we may need to quarantine the entire class for 2 weeks, including the teacher, because they would be considered close contacts. And depending on how it spreads or who the student was nearby, we may need to quarantine more than one room at a time. Which then also leads to some staffing issues if teachers and students are needing to stay home, or if a teacher needs to stay home, we would need someone to teach that class. So that it just becomes pretty complicated pretty quick based on stories we've heard from people we know in other schools. Half of the staff live or have high risk factors related to COVID. We have parent support, so parents agree with virtual learning in general. Parents say their child has grown this year in general. Parents are saying they're pleased with our overall plan and that we are providing high quality instruction. There are some unknown medical issues for kids post-COVID. Not a lot is known about that, but it's a concern. And after spring break, there are 9 weeks of school. So again, if we focus on virtual learning, or we want to focus on virtual learning, there may be less learning going on if the routines are disrupted by opening too quickly or with not enough time left before the end of the year. And then lastly, I just want to end the presentation by saying there are positive reminders about virtual learning. Again, students who are attending every day are learning and growing. And I should say attending and participating and turning in work. It's kind of 3 things you need, not just logging on and watching the screen, but actually participating in the lessons and then turning in the work. And then lastly, I want to make very clear, all SJA students have the ability to connect to class. So everyone has a Chromebook, everyone has a hotspot, everyone has the boys and girls location available if you need a safe place for your child to be. We know that housing situations can be tricky sometimes. So if you need a safe place for your child to be during the day, they can go to the Boys and Girls Club location. And then we do have a school counselor available for our students. And if you don't have one of those 4 things in place, please communicate that with us. Because if you don't have one of those 4 things, it's because we don't know about it. If we know that you need one of these 4 things, we will assist you in getting that quickly, okay? So that's the end of our presentation around that. Just wanted to share with you what you said on your survey and give you some other information. So there aren't many of us here on this call, but this is the time for questions and answers. Any preguntas que ustedes tienen, podemos responder. So I'll open it up for any questions at this time. Y si no hay preguntas, vamos a terminar esta reunión. Gracias por asistir a esta reunión. Thank you for coming to this meeting. And we will post this if people want to watch it, if they weren't able to make it. And again, the first Wednesday of each month, we will be available for a virtual meeting starting next week. All right. Thank you very much for your time. Have a great day.